Well, hello, and thank you for joining us. The Centers for Disease Control says a U.S. outbreak of the coronavirus is inevitable.
And that despite efforts to contain the spread of the virus at border crossings and ports of entry. But what about the country's shipping ports like the Port of Corpus Christi? Chris 6 News reporter Greg Chandler joins us now live from the port. And Greg, how many crew members come here a year?
Between 11 and 12,000 a year, Katya. That's according to the Corpus Christi International Seaman Center. And they arrive on ships flying several different foreign flags. Now, to prevent the spread of the coronavirus, federal government has updated its regulations for commercial shipping. As of earlier this month, commercial vessels that have been to China within 14 days are only allowed into U.S. ports if nobody on board is sick. Now, those vessels also have to report any illness or death aboard ship to the Centers for Disease Control within 15 days of their arrival in the U.S. And if anyone on board gets sick while in port, the Coast Guard must be notified immediately. And that's why the staff at the International Seaman Center here isn't worried about coming into contact.
None of my drivers are worried about picking them up and taking them, bringing them here. I'm not worried about it at all. If they're sick, they're not allowed to leave the ship. They don't give them their visas, and they can't leave the ship without a visa.
Now, Sharon Emerson says she hasn't spoken to any crews who have been to China since the outbreak started. Though a ship was leaving for China today, she says that Filipino crew told her that they plan on staying north of Singapore, away from the hardest hit areas. Reporting live, Greg Chandler, Chris 6 News.
Thank you, Greg. Excuse me. A biotech company in Massachusetts has sent the first batch of coronavirus vaccine to federal health investigators for testing. Drug maker Moderna Incorporated shipped the quickly developed vaccine to the U.S. government researchers who will now launch the first human tests. A clinical trial is expected to begin by the end of April. The vaccine will be tested on several dozen healthy patients.